Hello, everybody. Welcome back to the Genius Project. This is project number 3. And Carolyn Van Dyken and myself have labeled it the patient perspective. Today, we are really blessed to have one of Carolyn's patients here to talk about her journey and how things have changed for her, moving from a biomedical approach to a biopsychosocial approach. Carolyn?
All right. Thank you, Susan. Well, first of all, Andrea and Arlene. So Andrea has joined us, and Andrea has been a patient of mine for about 8 or 9 months now. And Arlene, her sister in the background, if you can see the video there, has been her strong social support through this whole journey. And so she has joined us as well on this podcast. And what we want to do today is just get a sense from a patient's perspective what it has meant to change or move from a biomedical sort of approach in a persistent pain problem to a biopsychosocial approach. So I'm going to just tell you a little bit about Andrea to start with. I'll give you a bit of her background and story, and then we're going to just hear from Andrea and get her perspective on this. So Andrea, I don't know if you've had a birthday, but at last recording I have, you're 44 years old, and you came to see me about 8 or 9 months ago, and at that point you'd had about a 9-month history of excruciating pelvic pain. And it really kind of came out of the blue. It started in November of 2017. You woke up one morning and had extreme perineal pain and didn't quite know what to make of it. And so your first instinct was to go to the internet to see what was going on. And your history was that you'd had a mesh repair done about, do I remember right, 14 months prior to waking up with pain, Andrea?
Yeah, 16 months prior.
16 months prior. And so had a successful mesh repair done for stress urinary incontinence and had really no problems in the post-surgical phase with that. And it really did fix your incontinence, didn't it?
Absolutely, 100% completely gone. I could go to any aerobics class, I could run, I could do everything and have no issues.
Right. But the other side to that was that you did not do any rehab for your pelvic floor either prior to or after that surgery, correct?
Absolutely. I was not informed that that would be something that was even remotely a possibility.
Right. So you had the surgery, it was successful, and then about 14 months later, you woke up with severe pelvic pain. Yeah. And, we've had a lot of laughs in our office around, you would self-labelize yourself as a catastrophizer. Is that right? Don't let me put words in your mouth.
Putting it mildly.
So you went from 0 to hero, went to the internet and learned all about mesh repairs and kind of the big mesh challenge that we are in at this point, and decided that this was actually a problem with the mesh. And that's kind of where your journey started.
And I think too, it's important to note that the very first thing that I did was not actually go straight to the internet. I actually went straight to my doctor.
Beautiful. Okay.
And got no answers, got no indication as to what the issue could be. So I was put in a position where it was like I felt I had to be the one to diagnose myself.
Right. Okay. Thank you. Thank you for clarifying that. Okay, so let's move on in the story a little bit. And so that led you down a rabbit hole to some extent, right? And into that dark world of kind of internet searches that led you to kind of the scary place around, oh my God, the mesh is the problem, right? I had this mesh put in and now the mesh is causing me this pain. Now, again, for those of you who may be watching us internationally, in Canada, we have a public healthcare system, but it takes a while to get through that system, especially for something non-emergent like this. And so Andrea made a choice at that point to actually seek out a surgical consult in the US and to ask whether or not it would be appropriate to have the mesh taken out. And so can you tell us what happened there?
So I had an MRI in Ontario, which of course showed absolutely nothing. So it's unexplained. Maybe your pain is not really as bad as you think it is or feel it is. So then when I got in contact with a doctor in the US, 100% this has to go right here, right now. Which I believed. And to this day, I still question, did it have to come out? Did it not have to come out? Anyway, it's a moot point. It came out, and away I went to the US and had it removed very quickly, within 6 weeks.
Right. And for those of you who do live in Canada, there was a real cost to that, to Andrea. She had to pay $20,000 out of pocket to go to the US to have that mesh removed. Okay. And the symptoms that drove her to that were vaginal pain, severe vaginal pain, urinary frequency, feelings of incomplete emptying, pain with peeing, and getting up multiple times at night to pee. So that's sort of what drove her to actually make this surgical decision. So she had the mesh taken out. Again, that was a successful surgery. She had a wonderful surgeon that she did feel connected with, and felt that actually went well, correct?
Absolutely.
Yeah.
He was fantastic. He was, definitely on his game in terms of the mesh world. So from that perspective, did I trust him and feel like I was in good hands? Yes.
Right. And what happened when you woke up from the surgery?
I had this, it wasn't exactly the same pain, but it was equally as disturbing, loud.
Right.
And then it started to spread, basically.
Okay.
And I was feeling it in different places, primarily all down my legs, down my backside. It was devastating.
Okay. And so you went home quite quickly after that surgery and went home to recuperate. And what did that recuperation period look like for you in the next couple of months?
I was completely bedridden. And I think one of the most difficult things was the misinformation between you can move or you cannot move. And so because I was in so much pain, it felt like, Andrea, don't move. So I spent, how long in bed? I was completely, months and months in bed. I'm going to say at least 5.
Right.
100% bedridden.
Right. And if you had understood pain and what your brain was telling you with pain, what you understand now about pain, would that have changed your post-surgical recovery? What do you think? Knowing now what you know, would that have changed how you recovered in that phase?
Absolutely. What happened was that the fear, so the more pain I had, the more the fear grew. And at the time, I had no idea that if I was afraid, that would increase my pain. And of course, that's exactly what happened. And I fell apart. I wasn't sleeping. I wasn't eating. I lost tremendous amounts of weight. It was all encompassing. Right. So to just say that I was bedridden is not the whole picture.
Right. So the cost to you was really significant in many, many ways.
It was life-changing.
Yeah.
I was not living a life that was even remotely close to what I had. I was completely disengaged. The pain was so encompassing. I spent days lying flat on my belly, not moving, just get up to go to the bathroom. That was a chore. That was it.
Right. So let's move on a little bit from that. And so it came, I don't know who made the recommendation initially for you to seek out some pelvic health treatment, but you did about 3 months, if I remember right, 3 months post-surgery, you went and found a local pelvic health physio.
I actually read it on the internet.
Okay, the good old internet.
This could potentially help.
Okay.
So of course I found the closest pelvic health therapist because I wasn't moving. I wasn't walking. I had to have somebody, drive me there, struggle to get down the stairs and into the car, and go see somebody that maybe they could help.
Right. And so how did that go?
Horribly. So when I walked in, it was basically, I didn't personally feel that this person had an understanding of my level of pain. Went straight into a internal pelvic exam. Oh, let's see what's happening with these muscles. And of course, the one visit that I had with her, went home and had a pain flare for at least a solid week.
Right. And so did you go back again, or did you just go the one time? The one time.
Just the one time.
All right. So was there any sort of screening or sort of history taking or understanding of the complexity of your problem, or was it just, let's see what's going on with these muscles and let's start working on it?
It was me basically trying to unload as much of my history as I possibly could. I have endometriosis. I'd had a hysterectomy at 37. So I was trying to give her all these pieces. And it was, okay, yeah. Jump on the table and let's see what's going on.
Right. Okay. So we would call it a very biomechanical approach. And clearly you had been in bed for a couple of months. You were kind of freaked out, and you know, sort of that whole component was sort of glossed over to let's just fix the tissues.
Yes, absolutely.
Yeah.
Which I believed. Yeah. It's got to be the tissues.
Sure.
Okay, let's dive in. Let's get these tissues fixed.
Okay. So that didn't work. And so you moved on, and you thought, okay, so how did you find, then you went to the States actually again.
Yeah.
But then your next thought, so how did you come up with the diagnosis of pudendal neuralgia?
The internet.
Okay. All right. So Dr. Google said, oh, if you've got pain in this distribution and you know, it's sort of after a mesh removal, then it must be pudendal neuralgia. So you found yourself.
I think too, what's really important is this entire time, I am still constantly visiting pain clinic in Toronto, my GP, and nobody is coming up with any answers.
Right.
So simultaneously, I'm trying to access the medical community for help, and it's not working.
Right.
And so then I'm struggling, and I'm looking to self-diagnose.
Yeah. And I think that a lot of patients find themselves in that position, right? They go through the medical channels. Is it different in the US that way, Susan? Do you have any comments about that?
It's a very similar story that I would hear here in the States.
Yeah. Yeah.
Absolutely.
So patients do their best. They follow up with their doctor. They go to the pain clinics. They sometimes see a psychologist or psychiatrist, and they're working through all the different pieces, but no one's really putting the whole picture together. And so you start searching, right? I mean, we talk about Dr. Google, but that's what the patient is kind of left with at that point, right?
Absolutely.
So you found a wonderful doctor in Arizona who then said, you know, I can treat you, I can look at that. And so you went down and had a series of pudendal nerve blocks. Can you tell us a little bit about that?
So I thought that this was going to be the answer. If you can shut those nerves off, this is what I was told. If you can shut those nerves off, it gives them a chance to basically reset, and life will be better. So sign me up. I'm all for it. Off I go to Arizona.
Right. And so again, coming from Canada, that's a payment out of pocket. No one's going to reimburse you for that. So there's a significant financial cost to that as well. As part of that process, you actually did see a physio as well at the clinic that you went to. Yes. And you actually brought me the physio's report. And again, a very accomplished physiotherapist who does great work and, you know, has good manual therapy skills. But when, you know, we kind of look at the whole report, it is very, again, biomechanical, very biomedical around, you know, your low back pain posture and the structure and what's going on with which muscles are tight specifically and which nerves are sensitive. Mm-hmm. In that report, my observation was that there was not, again, a psychosocial screen or recognition of the role of sensitization, despite the fact that at this point, you'd been in bed for 5 or 6 months, and you had completely disengaged from life because of the pain.
What I think is really interesting too, because I have had such a long history of a sensitized nervous system, and all of these doctors have had my history, but nobody is putting the pieces together. Nobody wants to talk about the endometriosis. Nobody wants to talk about why I had the hysterectomy. Nobody cares about any of that. It's all mesh, mesh, mesh.
Right, right. Okay. So fortunately, at that point, that physiotherapist had actually heard me speak at an international conference. And so she had actually given you my name and said, hey, she's only about 2 hours away. So not a local physio, but not that far, and certainly within Ontario. And so when you guys got back, you gave me a call and said, hey, can we come up? Right. And that was sort of the start of our journey.
Yes.
Right. Okay. So let's talk a little bit about that. What did that look like from your perspective at that point? So just kind of go back to that first time you came in, to the paperwork that you had to fill out. Tell us a little bit about that whole process.
So when I got your name from Arizona, which was a little bit funny, I immediately, sent off an email asking for help. Got a response right away. And I think the thing for me was that the pieces sort of fell in line very quickly. So yes, I could get in. Yes, it was in Huntsville, which is, 2 hours away. But to me, I didn't have to get on a plane. So this is close.
Right.
And then I get all these. So yes, you can come in what, a week or two, I think. And no problem. We're going to make this work somehow. And this is where Arlene comes in. She signed up for driving me because I'm not sitting at this point. I'm still laying down. And I get all this paperwork. And I'm looking at this paperwork. Well, actually, I'm not looking at it. Somebody else is looking at it. And we're going over the questions. And I'm thinking, these questions are ridiculous. What does this have to do with my pelvic pain? Like I've been on all kinds of medications. I've been in the OR multiple times. And now you want to ask me how I feel about stress? Like it was crazy.
Right, right. Can you, I remember you telling me that that first set of paperwork you weren't able to fill out yourself, that actually your family went through it with you sort of question by question, and you did kind of a page at a time and then took a break and then came back at it.
Yes, and by take a break, it's like take a break and we'll revisit this tomorrow. So
Right.
It probably took close to a week, I would think, to get it all completed.
Right. And after that first session, did you see the value of the paperwork?
No.
Okay.
No.
When did you start to see the value of understanding kind of that deeper component, or that what we would like to call maybe a whole person perspective?
Not until much later. I'm going to say months later.
Okay. All right. So we did the paperwork repetitively, right? We did it sort of every 6 or 8 weeks to kind of see what was going on. Mm-hmm. And let's just go over some of the scores just to kind of see why it was so important to take this sort of whole person approach with you. Because you get it now at this point, right? Now it kind of makes sense.
Now I understand. Yes, absolutely.
Yes. Yeah.
Then it was crazy.
Right. Thinking, what is this, right?
Mm-hmm.
Okay, so your stress levels were in the moderate category. Okay, your anxiety was extremely severe. This was your self-reported sort of anxiety levels on the questionnaires. Your depression was in the moderate level. And then sensitization. So we talk about how sensitive is your nervous system. And so you were actually in a quite sensitive category on that questionnaire. Mm-hmm. Catastrophization. So remember, catastrophization is just that piece that we all struggle with. It's the tendency we all have to kind of maybe make it a more significant problem than it actually is, and we just can't cope with it. So it's a bit of a coping kind of questionnaire. So you were in the severe category for that, right? And,
Mhm.
you know, you and I have sort of talked about since then that was sort of your modus operandi. You kind of lived in a catastrophizing world to some extent every time something happened, right?
Yes.
Your positive affect, so just your overall sort of mood or belief that you could be well, was low, and you had high fear. And your self-efficacy, so your confidence that you could change this problem and participate in your daily life, was as low as it could be. So it was 1 out of 12.
Yes.
So that's kind of where we started from,
Yeah.
right?
Yeah.
And any thoughts about that?
I think it's a little bit hard to look at now.
Is it?
Yeah.
Okay.
I see the improvement. It's just it is difficult to go back and sort of revisit that.
Why is it difficult?
I think because, like, especially for the self-efficacy, like, that I was so disempowered and so afraid, that, you know, this was my life. My body had betrayed me. Just everything was as low as it could go.
Right. Okay. You have some perspective on that at this point. And
Yes.
so is it kind of a bit hard to remember how low you were at that point? Is that the part you're struggling with as we talk about it?
Yeah, I think so.
Yeah.
I think so.
Okay.
So can I ask one question here?
Sure.
Andrea, what got you to return for a second visit?
To Carolyn?
Mm-hmm.
There was actually no real question about it. I remember specifically when we left. So because it was a 2-hour drive, we actually had to spend the night in Huntsville because I couldn't drive home. So my sister and I stayed in a hotel, and I left and basically looked at Arlene and said, like, really, is this gonna help? And that's when Arlene jumped in 100%. Arlene jumped in. I think it's really, really important to note that because I had been so disempowered and that I had experienced so much trauma, I was torn completely between who to believe. And because Arlene had a different perspective and she could step back, it was Arlene that said, we're going to try this. We're going to jump in wholeheartedly. And so Carolyn had actually given us some reading material. And for me, because I had no concentration level, this was ginormous, that I was going to sit down and read a pamphlet at the grade 6 level and find some information. And so we went back to the hotel, we read it, and Arlene was so excited. So to answer your question, long story short, how did I come back? I came back because of my support.
That's so important. Thank you for sharing that, because, you know, I could hear the struggle that you were having just even reflecting upon that first visit and the paperwork. And I think many people feel that very, very, very same way. And I think that, you know, having that support is so critical. Thank you.
Yeah.
Arlene, do you want to just give us a few thoughts around those early days for a moment, and just what you kind of gleaned from kind of hopefulness perspective, that you had watched your sister over the last 8 months and you were very close to each other. I've witnessed that relationship over the last 8 or 9 months as well. So what did that sort of mean to you when you started coming up to Huntsville?
Honestly, Carolyn, it meant everything. I think you'll recall just how emotional that first visit was for us. And I'd been to various doctor's appointments with Andrea. I had been here bedside day after day. I'd looked after the kids. And for the very first time, I believed that this was the right path. And that was before we even started reading about Understand Your Pain. Just that very first visit where you took the time to look at the whole story and you weren't at all shocked. You weren't at all confused about where this was going to go. You were so confident that, yes, there is a light at the end of the tunnel, that very first visit was a really emotional experience. I remember walking out of that office and we phoned home to inform the family of how it went. And I mean, I was in particular like really tearful, just because I was so relieved that, yes, you know what, I think this is going to be great. And then we went back to the hotel and we started reading, and it was like we came back the next day for our second visit, and it was like that book had been written for Andrea. Like we were racing through the chapters. Where are you? Where are you? And I said, your picture needs to be on the cover of this. It literally, and the fact that somebody somewhere had written something that just encapsulated the whole experience so well was so confidence inspiring that from then on, there was just no question that this was going to be the path to success.
And I want to highlight here, so thank you so much for sharing that. I want to highlight here that I really feel like Andrea's success in this journey has been a reflection of, first of all, her readiness, your readiness to change, Andrea, right? Your readiness to sort of do something different. Also, your willingness to put in the work, to do what needed to be done. And then also your immense support system that you had, right? That social connection and that ability to kind of, especially in those early days when you had a lot of brain fog still and you weren't processing things, to have Arlene there at every visit to reinforce what was being said, to reflect. I saw that as being a huge and significant component of your journey.
And I think too, what is important to highlight is that months later, I mean, I'm 8-9 months into this, it is still equally as important because I do still have pain, and I do still have days when I will call Arlene or text her and say, like, this just is so overwhelming. And so it's that constant reinforcement of putting the one foot in front of the other. No, go back, do the program, have hope, have faith, and it continues to be equally as important as the very beginning.
Yeah. So having a cheerleader, if there's people out there listening, or if you've got a really tough situation, which clearly Andrea, is one of my tougher patients. This is not, Andrea's not my average patient. She's one of my tougher patients. And having that support is really great, right?
Mm-hmm.
Yeah. So I wanted to just kind of highlight a couple of things. Where did we start with Andrea? Because she'd already had this experience with diving into sort of muscle tension. And so we actually just started with movement. Here was a young woman in front of me who had not moved in 6 months, who was afraid to get out of bed, was not sitting. And so we really just started with movement experiments. Do you remember that first session, Andrea, when I just had you, Andrea, show me what it would be like to squat? And you're like, can I squat? Is it okay to squat? Am I not going to, do something to my pudendal nerve? So those first days of just learning to move, but you surprised yourself. Every time we moved, you're like, oh, I can do that. That's okay.
Yes. I still surprise myself.
Yeah. So it was really about building safety again, wasn't it? About sort of challenging your beliefs and thoughts that movement was dangerous.
Yes, absolutely.
We started really basically that way. And then we really started on, you were, again, very hypersensitive. It didn't take much sort of touch anywhere where even light touch caused pain.
Yes.
Right? And we know that that's part of the sensitivity of the nervous system. And so what were some of the kind of rules that we had, and I showed Arlene how to do some of this, you did some of this yourself. The rules were always around, do not practice pain. Right? So if you're going to do something to desensitize the system, we have to do it in a way that does not create more pain.
Yes.
And do you think that was, if you could contrast that to sort of the typical, let me release muscle tension and that's going to be painful, maybe some of the stuff that you'd experienced prior to that, how did that build confidence in your system?
I think I was in such disbelief that I could get on the table in your room and you could do something that it would initially drive my nervous system crazy, and then teach me how to make it okay and acceptable for my nervous system. And so once I learned that trust, my body felt that trust, it was just like the building blocks fell into place. That sounds a little simplified,
Yep.
But that's kind of how it worked.
Right. Right. So it was about building trust in me. It was about building trust in yourself. It was about building trust in the ability to move again.
Yes.
Right. Yeah.
Yes. I think the trust in myself was probably the biggest obstacle.
Okay. Yeah. Yeah. You lost again, that disempowerment. You lost the ability to trust what was safe and what was not safe.
Yes.
Yeah. And so it took us a couple of visits before we did an internal exam. And I think that's a message that Susan and I talk about a lot, is we don't need to dive into those muscles. It took some confidence building, but we needed to go there to actually demonstrate whether or not this belief that you had that, so the pudendal nerve had been damaged in some way in the mesh surgery was true or not true. We had to kind of put that thought on trial a little bit, right?
Yeah.
So what we noticed was there was actually very little tension in your pelvic floor, right? And you were worried about scar tissue from the surgery, and there was actually very little sensitivity internally. Mm-hmm. And we did a lot of work, more gentle movement work to really just start to calm the nervous system down. So we've played with many different things, Qigong and Yin yoga, different meditations, different movement practices. Which of those have you kind of gravitated to? What do you think has helped you through this journey in that way?
I think the things that work for me the best have been the meditation. And for me, I know there's like 10,000 different meditations out there. For me, a personalized meditation is what really resonates with me. So something that is directed at my story. And for me, the yin yoga, because it just forces me to slow right down. You're not consistently moving. I was a crazy workout person who believed that you had to do more to be better. And so the yin yoga forced me to stretch this out, slow down, breathe, observe how you feel. And that was a completely different approach for me.
Right. And so then we went on to really talk about your fears and setting goals to get your function back again, right? We did eventually look at neural tension and whether or not there was neural tension along the kind of the obturator nerve and the pudendal nerve. And there was actually very little of that with you. There was some physical sort of component to it, but it wasn't a major driver. Would you agree with that at this stage based on everything that you know?
Yes, I would.
Yeah. All right. So now, sort of 6 weeks later, so we're going back in time still, but in 6 weeks, you were now driving. You were starting to cook some of your family meals. You were still definitely getting some assistance with your housework at that point. We redid the paperwork, again, the lovely paperwork, but you did it yourself, and you did it within 15 minutes instead of having your family do it for you. And you were now sitting in the front seat to drive back and forth. So I still put the wrong town in there. I didn't change that. You're in Aurora, right?
Newmarket,
right, to Huntsville, right?
Yeah.
And so actually there was quite a nice change because you developed confidence in your tissues again.
Yes.
Do you have any comments about that initial sort of change in your symptoms?
It wasn't a quick process, but I think it did happen consistently. Like every week there would be something new, better. So I would make it halfway to Huntsville. I would be able to sit in a restaurant. There was the constant building blocks that, I can drop my kids off at school and cook dinner.
Right.
It was those pieces coming together, I think.
Beautiful.
And still are. Like I still
Yeah.
am consistently setting goals. They're just bigger ones now.
Right, which is great. So when we redid that paperwork 6 weeks later, there was a significant change. And I guess one of the things I want people to understand is that the nervous system, under the right set of circumstances, changes quickly. So your stress went from, sort of a moderate level to normal stress levels. Your anxiety went from extreme to mild. Your depression, self-reported depression levels went from moderate to normal. Your sensitization in your nervous system started to decrease. Your catastrophization went way down because you were starting to gain some control and understanding of your symptoms. You became much more positive, much more hopeful. Your fear went down, and your self-efficacy, I think that's the piece that really, you sort of had said earlier, really bothered you, went from 1 out of 12 to 10 out of 12, which is amazing.
Yes.
Yeah. Any thoughts or comments on that? So here we are 9 months later, right? 9 months later. And so I would call this stage, I don't see you as often anymore. We're down from our weekly visits to bi-weekly at this point. And that was a big step, right? Oh, I can't come for a week. Yep, you're going to be okay. This is going to go well. So I call this stage supported independence, right? I'm supporting you in becoming independent and becoming the person, again, that you want to be, doing the things that you want to be doing, right? And so what happened to your newest sim? I think she left your lap. I don't see her there anymore.
Yeah, so one of the biggest things for me was I got a dog.
Yeah.
And so this is part of my goals that I was telling you about. So I kept stretching these things that I wanted back in my life. So I wanted to be able to look after my children. I wanted to be able to travel with my kids. And I wanted to get a dog, but in order to have a dog, you have to be able to walk everywhere and be prepared to get up at 5 a.m. and all of these sorts of things. So I just recently, 10 days ago, got a puppy.
Aww.
So this is one of my greatest sims. The fact that she's pretty loyal to me in the 10 days that we've had her. She's definitely my dog. But I look after her, and I look after my children, and I do all the things that need to be done. So it's one of my greatest joys, because I know that, this isn't a week commitment. This isn't like going to Disney World where all I have to do is get through 7 days. Mm-hmm. This is years of you can do this.
Right. And so can you tell us what a sim is? Because some people who are listening won't know what a sim is.
I forget the definition.
Okay, that's fine. You're using the terminology. It stands for safety in me. Remember, right. And a dim is a danger in me. So we talked long and hard about building more safeties and reducing the dangers so that your nervous system will become less freaked out about inputs that it receives, right?
Right. So, and I think one of the big things here is that what that forced me to do was recognize that mind-body approach, that I did have so many dims going on, and I wasn't even recognizing them. I wasn't familiar with it. That's just life. And so the new way of living I'm going to surround myself with sims, and it is actually going to have a physical effect.
Right. Beautiful. And so I don't want to make this journey sound too easy, sound too trite. Look at this. This is fantastic. So it's not, right? We're still struggling. The next sort of chapter, it looks like, will be to really start to change some of those underlying core beliefs and thoughts. And so we've talked about maybe a cognitive behavioral therapy referral, and we've made that referral at this point, and you're waiting to kind of get that organized. And so do you want to just maybe share with us, just as a parting kind of session, kind of any thoughts you have about your journey, any thoughts that you would like to share with therapists who are listening and are struggling to make this change from a biomechanical approach to a biopsychosocial approach, what that has meant to you, or what you would like to kind of leave as a parting thought?
I think what's really important is yes, I'm sitting here on the couch and I have a dog in my lap and everything looks great. It is not all sunshine and roses. And my journey is, I still look for improvements and I still want those improvements. And I do have to struggle with it and go back and do the program and believe in it. But the difference being, I do have hope that I will become better at the program and I will see better results and continue that for the rest of my life. That this is not just a piece that I have to do now and then be able to stop and I'm just going to be better. This is a lifestyle change. In terms of for professionals, my biggest, I guess, thing that I would say is that for professionals to actually listen to the patient. I was not heard for a very long time. And what that did to me was make me believe that maybe there was something wrong with me. Maybe this isn't really as bad as I think it is. So if professionals could take a breath, could take a beat and not assume that they automatically know the answer and work together. There's this, like, one side works completely independently from the other. It's like I often felt torn between the two communities, sort of like a child of divorced parents that aren't getting along, and I'm caught in the middle. And somehow, if they could come back together and realize the goal is the patient.
So the two communities, that's really well spoken. The two communities, how would you label those communities, Andrea?
They're on completely opposite ends of the spectrum.
Right. So are we talking sort of a biomedical, biomechanical, structure-based, fix the tissue community versus let's treat pain as a whole person experience community? Are those the communities that you're referring to?
Yeah.
Okay.
Yes.
Okay. Because there's a role for biomechanical treatment, right? We need to remember that tissues do become injured, right? And you and I have had the conversation around, should the mesh have come out? Should it not have come out? And who am I to say 9 months into your journey that mesh shouldn't have come out or should have come out? I wasn't there in that moment with you. And the best decision was made at that time based on all the information available, right?
Yes.
And so we need to respect that there are times where the tissues need to be treated in some way, but that when the symptoms persist, that we need to always consider the bigger picture and the whole person experiencing the symptoms.
Absolutely.
Yeah.
And there's not a lot of that. Like, even now with me being, having had success, and if I try to reiterate that success to the medical community, it's like it's disregarded, even though I'm living proof.
Right. And not only are you living proof, but there's a lot of great scientific research and information to back that what you did is actually the best evidenced approach that we have right now for persistent pain. And yet we don't wholly accept it or bring it into our practices. And so that's the challenge.
Yes, absolutely.
Any final word before we say goodbye? I can't thank both of you enough for sharing your story and for just allowing us a glimpse into your life on this journey.
And we can't thank you enough, because introducing us to the biopsychosocial approach has changed everything, not just in terms of mesh recovery, but I think in terms of what life looks like for all of us, not just Andrea, but I've gained so much from being in every session and understanding what a mindful, healthy mind-body connection life should look like for everyone, and making a patient feel that self-efficacy and hope for the best quality of life possible has meant absolutely everything to us.
Awesome. Well, you guys have been, it's been a really interesting journey. I think you have your journey shirt on, do you not? What shirt do you have on right now? Do you have
I
your,
know,
But that would have been brilliant. You're right.
about 6 weeks in, Andrea found a journey t-shirt.
No, Arlene did.
Oh, Arlene did. Okay. And said, oh, this is the shirt that you need to
Embrace your journey.
That's embrace your journey. So
I think those are fantastic parting words to say.
yes.
Embrace
Yeah.
your journey.
Yeah.
Embrace
That's,
your journey.
that to me sums it up right there.
Yeah. Well, thank you again, ladies. We really appreciate you taking your time, and I hope that your story will inspire therapists and clinicians and patients alike to just look at their own core beliefs around the approaches that they take. So thank you again. Really appreciate it.
Thank you, Carolyn. Thank you,
Thank
Susan.
you.
Okay.